Hello, it's a pleasure to be with you at your conference. I've been asked to talk to you about specialisation in social work, and I'm going to start by making a few general comments and then look at different types of specialisation we've had in social work across the years. So, the general comments first. I want to say that you can't talk about specialisation without looking at the general. The whole field of social work is huge, and so we're all specialists in some way or another. So the question to be asked is, what kind of specialist am I? What kind of specialist are you? And because specialism involves limiting within the field, most people are limited specialists. They use specialism to control the range of things that they have to deal with. And some people are super specialists. They're extra special because they have built up extra knowledge and skills which make them a more advanced specialist. Now, some people would say that limited specialism and extra specialism, advanced specialism, go together, because if you limit what you do, you have more focus and you're not trying to cover a huge range of issues. But we all know people who've done the same thing and again over the years, and they've never got any better or any more advanced in what they do. They've never learned from what they do. And the other problem with the limitations of specialism is that it means that we may limit ourselves so much that we don't deal with the complexity in people's lives. The other thing to remember is that specialisation is not in the control of the practitioner or the social worker. It's often created by public expectation or by management or political decisions in how agencies are organised, or it comes out from the decisions of other professions and other organisations and the impact that they have on us. Well, bearing those general points in mind, I want to talk about 4 different kinds of specialisation and how they have affected social work over the years. So the first kind of specialisation I want to talk about is where agencies specialise or practitioners specialise in particular types of client, particular problems, or particular social issues. This is probably the most common kind of agency and service specialisation. And a good example of that is how specialisation has changed in England over the years. For the past 20 years or so, local government social work services are usually divided into children's and adult services according to who is seen as the main client, so a child or adult services specialisation. Previously, from 1971 until the early 2000s, there was a single local government social services department which was seen as a family service. So children and adults in the same nuclear family were dealt with by the same social worker. And social workers were grouped in teams serving particular localities. And an important aim of this was to link responsiveness to broader social problems, community problems, to individual and family social work. So concepts of family and community were the main organising factors. This had happened because there were coordination problems in the previous system, which operated from 1948 to 1971. During this period, there were usually 3 separate departments. One dealt with children, one with mental health, and one with disability and old age. But the problem with this was that if there was a family with childcare problems, then they often had elderly, disabled, or mentally ill family members as well. And sometimes there were 3 or 4 different social workers from different departments visiting them. That was very inefficient. So for the previous 100 years, before 1948, slightly longer than that, most social problems that were seen as appropriate now for social work were dealt with by the poor law. So that followed the assumption that social problems mainly arose from poverty. So in this example, we can see how political and public perceptions of the time affected the organisation of services. Until the 1940s, it was acceptable to see problematic social issues as primarily about poverty. Division between mental health, disability, old age, and children connected with the roles of various education and health professions that were larger and better established. So their professional specialisations affected social work. Another important facet is that agency, client, and issue specialisations is often concerned with narrower areas where specialist expertise is more relevant. An example is children's mental health work, which is often managed by psychiatrists and psychologists in specialised clinics, and social workers are just added into the mix. Hospitals and healthcare services are also organised by medical speciality, and teams of doctors, nurses, and other healthcare professionals follow these specialities and often have social workers attached to them. And so these social workers form specialised professional groups mimicking the healthcare and education specialisms. As well as this, clients, the general public, and politicians are used to education and healthcare specialisms because these are universal services everyone has experienced, and they have a high political priority in people's minds. So it seems sensible to fit social workers into the same specialisations. Detailed specialist knowledge is also important to clients and their families and the public and their communities. They expect social workers working with particular groups to be knowledgeable about the needs and issues that commonly arise. So practitioners working with children are expected to be familiar with child development problems. Practitioners working with particular disabilities or with older people are expected to know about the problems that their clients commonly face and to be able to help families and caregivers with detailed knowledge and understanding. So a general social worker is less acceptable to the public used to health and education specialisation than a general social work service. Another factor is knowledge of service provision and particular social issues. A palliative care social worker, for example, dealing with terminal illness and death every day, will be expected to have knowledge and understanding of the specialist services available for clients and their families in that situation, and an understanding of the progression of the main terminal illnesses. The same expectations are there for most of the major disabilities, for intellectual disabilities, and for the main mental health conditions. Social science knowledge may also contribute to the creation of social work specialisms in these areas. For example, loss and bereavement and family responses to illness and death, and the various models of disability. And you may wonder why I haven't mentioned criminal justice and practice with offenders and youth work. This is because I've been talking about the situation in England, and in my country, these are not regarded as part of social work. Youth work is a separate profession, considered to be part of education, and working with offenders, even young offenders, is part of the criminal justice system with separate training. Yet in other countries, youth work and practice with offenders is an integral part of social work. I'm now going to move on to look at two influential concepts about the general, which have had global impact on our understanding of what is special in social work. The first is the idea of generic practice. Generic practice sees all social work as having similar features that require the same knowledge, skills, and values. Examples of generic knowledge are an understanding of people's development through the life cycle, and particularly in childhood. understanding the social work system, social welfare system. Generic skills include making successful relationships in alliance with the people you work with, being able to assess and write analyses, reports and histories of issues in social situations, and being able to advocate and negotiate on behalf of people with other organisations and to get resources for your clients or for your community from your own agency. Generic values are ideas like human rights and social justice. And you can see all these ideas in the International Federation of Social Workers' global social work definitions and ethics statements. They are general in social work. Well, the idea of generic practice is that the same knowledge, skills and values can be used in any service setting and with any client group and using a wide range of ideas about practice. Now, the source of these ideas lies in American social work education. An important strand of early American social work education was to provide master's level courses for elite family agencies in the major cities and the general hospitals and mental health services. This led to an emphasis on generic transferable skills in interpersonal psychological interventions in family settings to meet the needs of healthcare and mental health agencies and these general family agencies. And being involved in these services lent social work a good deal of prestige in its early stages. That professional prestige contrasted with another strand of social work education which concentrated on rural areas and black populations in towns and on broader community services and public welfare provision and poverty during the economic depression of the 1930s. As American social work education and professional organizations were unified in the 1950s, the prestigious master's level generic social work education became the gold standard form of social work education. And this was transferred into the international organizations and provided a global view of what was best quality in social work as social work education developed internationally. In the latter part of the 20th century, this began to be contested by alternative Asian, African and European models of social work education. But it formed the basis of the idea that social work education should cover a range of skills and knowledge which social workers could apply to all sorts of situations. An example of the impact of genericism was in the 1971 reform of the social services in England, which I mentioned as one of the stages in specialisation. That was the time when there was an emphasis on family and community and a general service which provided non-specialised front doors for people with problems to come and get help. Social work practice was intended to be generic, either by social workers becoming non-specialised or with local teams coordinating specialised provision in a generic service. The generic approach was contested by social workers who didn't feel able to handle the level of knowledge and understanding required. And so these were people who wanted to be limited in their work. And so they developed specialised biases of various kinds in their general workloads. And other professions and services also contested the generic idea because they wanted social work to fit in with their view of specialisation. Well, the next model of specialisation I want to talk about is the idea of generalist practice and modalities. And I'm only talking about this because you'll find it in the world literature of social work and you may wonder what it's about. Again, this comes from an American terminology, which is to specialize according to the type of intervention that you use, or that's the American term is modality. That's why you see modalities referred to. The main modalities that people talk about are, first of all, casework. That's a historic term, refers to interpersonal interventions using relationships with individuals and families who present personal problems or who present social problems to the community. Currently, the language in North America refers to clinical practice. Again, it makes that connection with healthcare. And these are mainly counselling and psychotherapeutic practices focused on mental health, and often carried out in a private practice and clinic setting. This requires, in the United States and Canada, requires a specialist master's degree. So it has a higher status than a qualification in basic social work education, which is achieved by a bachelor's degree or a broader master's, and qualifies social workers to organise service delivery and public sector social services provision. The existence of clinical social work with its healthcare connections reflects the strong emphasis on mental health practice in the American profession, and that's not typical of most social work roles across the world. And the second modality is group work. That's social work working with people through meeting together in groups small enough for face-to-face interaction among all members. Sometimes there's educational and information giving aims in larger groups. Then community work is enabling people with shared interests to come together and work on agreed needs by developing projects or by campaigning to improve services. And then some accounts of generalist practice include administration of service provision as a modality, and other modalities you can think about, such as family therapy. Now, generalist practice in this context refers to using more than one modality in your practice. So, for example, someone who works with women having difficulty in caring for their children satisfactorily might work with the individual women and their families, or they might bring together women in groups to share experiences and learning and to provide mutual support. Or they might work to improve community and family support or services for domestic abuse in the locality. So you could do your casework or clinical work, but also work in group work and community work. Covering such a range of services and practices offers flexibility to meet people's needs. Group work and community work approaches also have the advantage they're more participative, and they empower people to take stronger control of what happens, whereas the interpersonal and psychotherapeutic work often leaves the power in the hands of the practitioner. But generalist practice presents difficulties. Practitioners don't feel skilled in every part of this range of activity, so they may not feel trained or prepared for it. They may prefer, personally, certain kinds of work. They may like to work with women and children rather than with groups. Moreover, the demands of the different kinds of work have different time scales. Interpersonal work with individuals may require flexibility and responsiveness, and a program of group work meetings or community engagements may involve timetabled events that don't fit with that. And that may be a particular problem where the political impetus for the work of the agency is more to deal with individual personal problems. Finally, the fourth kind of specialism that I want to talk about is about practice theories. And what practice theories do is establish specialisation around how a practitioner does their work. Now, while there is a broad pattern across the globe about what social work contains, some theories try to define particular approach to social work. And these are often called practice theories because they help you learn and understand how to do social work as you practice. Now, I identify 5 streams of thinking in practice theory, and again, each of these streams comes from different traditions of social work and is connected with the political and cultural expectations in different groups of countries. Thinking about these 5 streams, I start from the earliest tradition, which is typical of social work in the US and Europe as it emerged in the late 19th century. At this time, industrialization and urbanization led to major changes in society. In this stream of thinking, social work deals with the problems of these social changes. It's problem-based, and it aims to get back to a more socially cohesive society. There are two elements to this. Firstly, seeing change as a problem to which people must adapt, and seeing people as valuing stability in their lives and relationships rather than change. People in this stream of thinking mainly focus on how you can become more resilient to change in yourself and in your social relationships. And part of this is providing services, which in developed countries is usually about using the collective tax raising powers of developed economies to provide services, pay for services. The second stream emerged at much the same time, but in a different group of countries in Central Europe. And while it's Western in orientation, it doesn't influence the problem-based, more conservative approach of other European and US social work that you see in the problem-based stream. It doesn't see social change as problematic. It sees social change as natural and continuing in everyone's life and in every society. So people have to join in a process of shared learning. They just don't need to adapt. They need to learn about and participate in their society. So you need understanding about the world, and you need to take part in the world to learn and practice social engagement. So social pedagogy encourages shared activities and learning situations in which people can learn to take part in social change. The third stream of social work thinking is what we often call critical social work. This emphasizes that social structures in society generate and sustain conflicts of interest between different groups of people in the society. So society is not one general direction of development. It reflects different groups' interests and conflict between different groups' interests. Now, this formulation of social work is present in Western social work, but it's often sidelined by the rather conservative social cohesion conceptions and service delivery conceptions of social work. Critical social work looks at conflicts in structure rather than seeing people as having problems with social structures. An important new development here in recent years is the development of eco or green practice, which is concerned with combating the effects of climate change and helping people and communities cope with its consequences. Then there is a specialism which is social development. Now, originally, this was a stream of thought devised from welfare practice in British, French, and Spanish colonial administrations, and influenced also by the thinking of the Christian churches. As colonization receded in the 1940s and 50s, it was taken up by the United Nations, influenced by the US interest in their objectives during the Cold War. And in that context, it was seen as contributing social welfare aspects to the economic development in globalizing economies. More recently, however, this perspective has been taken on by African and Asian writers with a focus on participation in alleviating and eradicating poverty, building environmental sustainability and food security, gender equality, women's economic liberation, and responding to health and education inequalities and needs. The aim is to generate social entrepreneurship and political and economic capabilities as community resources rather than as contributions to global economic objectives. And finally, very recently, the emergence of indigenous theory connects with social development. And it's emerged particularly where colonization displaced pre-settler and pre-colonial populations and cultural assumptions. It seeks to formalize in social work practice the culturally and ethnically distinct local social norms and structures in previously colonized countries. It seeks to draw into current social work uh, the cultural, environmental, knowledge, political and social identity, and understandings of the pre-colonial and often oppressed population. So this stream of theory emphasizes cultural and local social identity as an important factor in social practice in previously colonized countries. Now, looking at these different streams of thinking and their influence in different parts of the world, we can see that each offers a dominant way of practice which might be typical of a particular group of countries or a particular region. Other streams of thinking might also be present as part of social work services, and we could think of these as specialisation. Within these streams of thinking, there are often formalizations of practice which are in themselves specializations. Within the US and European problem-based social cohesion stream, for example, ideas such as systems theory, cognitive behavioral task-centered practice exist and are still in use. But there is something of a shift there between practice theories which emphasize analyzing and tackling problems that people are worried about or that societies are worried about towards looking at people's goals and finding strengths and solutions which they can build up towards achieving the personal and social goals that they want to achieve. So whilst most of these ideas can be used in most forms of social work, you can take them up as a form of specialism within that stream of practice. And I mentioned the different kinds of emphases of different African and Asian writers in social development, which again offer different emphases in how you can approach social development. So in this account of specialisation in social work, I've emphasised how complex patterns of social work specialisation emerge in any society. Those patterns are formed by cultural, historical, political and social expectations and pressures. The particular pattern of specialisation in any country is, however, not a given. By developing expertise based on practice that social work develops from social science understanding, we can analyse the expectations and pressures and influence colleagues in other professions and more general public social understanding. In this way, social workers can develop and gain recognition for specializations which we see as relevant to the important roles that social work can perform in society and integrate our own pattern of specialization into broader social provision. If we think about and develop our specializations to influence thinking about social issues in society, social work specialisms can come to be recognized as a form of expertise, as a form of advanced practice, which doesn't simply limit the breadth and validity of what social work can offer to what other people tell us we can offer. So thank you for listening to me. And I hope what I've been talking about helps you in the other parts of your conference. The next slides give you a list of the references that I've used so that you can explore this material further. My good wishes for an interesting and enjoyable professional communication. Thank you.